Good afternoon, ladies and gentlemen. We're ready to get started with our task force town hall. Thank you for joining us. I'm Derek Miller. I'm the president of the Salt Lake Chamber and also the chair of the Utah Economic Response Task Force. We have a lot to talk about on today's town hall. I'm sure that all of you saw the exciting and important announcement that Governor Herbert made with regards to the state of Utah moving from red to orange in our risk levels. We will have him on in just a few moments to talk about what that means for the state of Utah and answer any questions that many of you may have. To begin today's town hall, we want to start with Senator Mike Lee, who has joined us to provide an update of what's happening in Washington, D.C. Senator Lee is part of the task force that President Trump put together in helping small businesses. I'm sure he'll tell us about that, as well as a possibility of a phase 4 in federal relief. All of you know about the PPP loans, the Paycheck Protection Program that was passed in the CARES Act just a couple of weeks ago. And Senator Lee, we're excited to have you, and we'll turn the time to you.
Thanks so much, Derek, and thanks to all of you for joining us. I'm grateful to have this opportunity. Over the last few weeks, stayed very engaged on a number of tasks that have come to the forefront. The strange world in which one can be largely unable to access one's own office and yet remain so busy. A lot of my efforts and those of my staff have been devoted to several different tasks, including at the front end, we worked a lot to help get people back into the country. This included, but was by no means limited to, missionaries who were working throughout the world, but we have a lot of time. Anytime you see Utahns traveling, maybe for missionary service, maybe for business opportunities around the world. In some cases, it involves humanitarian assistance of one form or another. But we had people all over the world who needed to get back in. That took a fair amount of time. Since then, since that has died down a little bit, and most people from Utah have been able to return to our state who needed to get home, more of my time has been devoted to a combination of working with businesses to make sure that they have the most up-to-date information and the resources they need available to them, and also working with constituents who are struggling to get their economic impact payments. The PPP numbers are significant. I wanted to talk about those for a minute. The PPP numbers from the first round of funding, the Utah-specific numbers include 21,257 approved loans. The total dollars approved for Utah added up to about $3.695 billion. A very significant chunk of change, certainly. The SBA reopened the PPP portal just yesterday on Monday at 10:30. From what we've heard, some banks are not even allowing new applications to come through their door because they still have so many that are in the queue. They don't create that expectation at the outset. There have been some frustrations over who's actually receiving the money, but and some frustrations over businesses that applied early on in the process and then didn't get it. There are many small businesses that fear that this $310 billion is going to go quicker than the previous allocation. I had a good chat with Scott Anderson yesterday, who indicated that this is expected to go fairly quickly. Two significant concerns have been brought to our attention in connection with all this. One, in order for the PPP loan forgiveness provisions to be triggered to be forgiven, businesses have to retain or rehire their employees prior to June 30th. But some businesses are not able to become profitable again until tourism picks up. For example, all the excursion guides and restaurants in Moab would probably fit into this category. So they could open, but they may have diminished business or no business for a while. And they worry that they would just be paying their employees for the sake of paying them rather than paying them for the sake of working. The second concern that's been raised exists on the unemployment side. Some businesses have applied for PPP and have been approved for PPP, but can't keep their employees on because their employees, or at least some of them, want to stay on unemployment because they're making more money. This is a concern that I and a number of other members of the Senate raised at the time Phase 3 was being passed. This issue could have been fixed before the passage of Phase 3. My colleague, Senator Ben Sass from Nebraska, offered an amendment, one that I co-sponsored, that would have ensured that an individual could not receive more in unemployment compensation than he or she had been making in wages before becoming unemployed due to the coronavirus. Unfortunately, that amendment didn't pass. It received 48 votes in the Senate, but not enough to pass. The EIDL numbers for Utah include 484 loans that have been approved with a total value of 105.8 million. Nationally, this was 38,000, just under 39,000 loans approved with a value of just under 8 billion. The EIDL advance numbers for Utah include 9,000, just under 9,800 advances set out with a value of just under $43 million. One of the things that we've got to stay focused on as a country, and particularly as a state, involves looking at data that come in continually, data that I'm trying to track, and I spent a substantial amount of time at the White House a few days ago asking for help in tracking. We've got to establish a database that allows us to track in real time various things that are happening that are difficult to track in real time at moments. For example, we need to be aware of what's happening in terms of those who have been diagnosed with a particular ailment not getting treatment, those who need preventative care or basic maintenance care not accessing it, suicide rates, things like this. These are all things that could be things that we need to take into account as we consider our timing for staying in lockdown in our state or in any other state. I think it's important to remember that. It's one of the things that I'm focusing on after being appointed last week to by the president to the Opening Up America Again congressional group. And so I'd love to get any feedback that all of you have. You can reach out to me or my staff personally, or you can also go to my website at lee.senate.gov. We've gotten a lot of feedback so far on this, and we welcome any and all suggestions that we have on this. Finally, while I was in Washington last week, I gave a speech about the need for Congress to get back to work. We've seen healthcare providers working 24 hours a day and 7 days a week. We've seen farmers and truck drivers and grocery store employees and pharmacists working to make sure that we continue to have access to things that we need in order to live. And we see parents working from home and simultaneously homeschooling their kids. Congress, meanwhile, is in recess. It's unacceptable, especially when Congress is purporting to legislate. You know, if Congress wants to remain in recess, it can decide not to legislate. That's probably not a good idea. If it's going to legislate, it needs to be in session. And so it needs Congress to reconvene. I spoke to my colleagues today, was on a conference call with all my Republican colleagues in the Senate. The Senate will be reconvening here in the next few days. Look, the challenges ahead of us are too numerous and onerous and complex to leave up to just a few meetings behind closed doors. We've got a lot of issues involving testing and masks, healthcare policy, liability, leave, regulatory reform, immigration, the judicial system. Those are just to name a few. All of these things require serious legislative action, and we can't give those issues the attention they deserve simply by sitting in our respective homes. And regardless of how many conference calls we have, we can't vote unless we're there. So we need to be back in session. I look forward to doing that in the coming days. Anyway, with that, I'd be happy to answer any questions you've got, but I appreciate you letting me join this call and participate in this.
Thank you, Senator. One question I did want to ask you about was your work on the food supply chain. We're grateful that when we do have the opportunity to go to stores here in Utah, the grocery stores and other stores, that we still find stocked shelves. I cannot imagine anything that would cause more fear, more panic than if we went to a grocery store and were not able to find food. That's something that I know you're concerned about, and more than concerned, something that you're working on. Can you tell us about that?
Yes. One of the things that we're worried about in the food supply is the availability of meat. As the chairman of the Antitrust Subcommittee on the Senate Judiciary Committee, been worried about there's a strange connection that I'm seeing between meat packers and processors and meat producers. There's this weird dynamic that exists between the packers, inspectors, and the producers of meat. Fortunately, we're still in pretty good shape in Utah as far as our availability, the availability of meat, consumer access to it. But there are some warning signs that a number of people have been pointing to, indicating that that supply chain could be in tough shape. There's also an adequate independent need to address a strange competition policy phenomenon that occurs where when the price of meat goes up, it often is the packers and not the producers that get it. And strangely, sometimes when the price of meat goes up solely to the benefit of the packers and not to the producers. We're concerned about this, and we think that one way of dealing with this situation at the same time that we're dealing with the COVID-19 specific concerns might be taking a good hard look at the requirement that every article of meat sold commercially in the United States has to go through a USDA meat inspection. There are already exceptions to this requirement. I suspect we might benefit from expanding those exceptions a little bit, including by allowing a state, at least throughout the duration of this global pandemic, to provide for its own meat certification. We shouldn't have this chokehold where the meat inspectors can indirectly bring about such a significant shortfall in the meat supply. Anyway, this is an issue that I've been concerned about. Senator Klobuchar, my Democratic counterpart on the committee, and I have put together a letter asking some questions about this. She and I don't agree on everything, and we don't agree on everything when it comes to the solution to this problem. But we both agree that there is a problem, and we're working together to try to find solutions to it.
Thank you, Senator. And then maybe one other additional question, if you have another minute. Have you heard, or have your other Senate colleagues heard, when Treasury may be issuing the guidelines for the loan forgiveness, the PPP loan forgiveness? We know that there were broad categories related to payroll and operating expenses, things like rents and mortgages, maybe even utility payments. When might businesses expect those details?
Yeah, I've been told that that's happening soon, and the impression that I've been given is that we are days away from the point where things like that might be issued. I don't yet have confirmation on that, but I'm going to stay on top of it, and I'll let you know as I hear more.
Great, thank you. We're going to turn now to Governor Herbert, who had an important announcement this afternoon talking about the state moving from red to orange. And here to tell us more about that announcement and answer any of your other questions is the governor. Governor, thanks for joining us. Governor, it looks like we've got you on mute. Sorry about that. Can you unmute yourself?
How's that?
That's even better.
Well, again, let me just begin and start over. Great to be with you, Derek. Good to hear from Senator Lee and others. We appreciate the good work of so many people out there that are making Utah look good. As you know, we've developed the most comprehensive state plan to deal with the coronavirus of any state in America today. And we've stayed true to that plan, helped developed by Spencer Cox and Natalie Gochner and Chris Cox in our Office of Management and Budget. Many bright people working on the science and the data analysis to help us have a plan. And we said if we work together on this plan, we'd see the trend drop when it comes to infectious rates. We'd make sure that we did not overwhelm our community, our healthcare community with this coronavirus pandemic, and we would make sure that we stayed the course. And by golly, we've done that. As you may know, I, in fact, unveiled a plan called Utah Leads Together on April 17th, our second version, but the first was March 27th, approximately 24th, I think. And the results are in. And the trends are good. The infection rate's down. We have the trends that the president's wanted us to follow, but we are following kind of our own advice because we're ahead of the president really on this too. And so today, because of that, and I just want to read a part of the plan, which helps us remember what our challenge is. It's not to get risk to zero. It's to manage the risk and make sure that we have an appropriate balance in this approach. And here's what the plan says. Managing the public health risk requires the state to identify, contain, and mitigate the spread of the virus while simultaneously reactivating the economy step by step. And that's exactly what we tried to do, and that's what we're doing. And so today, as you know, we have the 3 stages. There's urgency, which we're in, or were until 1:30 this afternoon. There's stabilization, which is the next phase, and then ultimately we get into recovery. And the good news for us is that today, because of all the data that we have and the trends and the trajectories that we see, we're able to announce today that we are going to move from red, which is high risk, to orange, which is moderate risk. So that's good news for all of us. That opens up opportunity in the economy to expand what we're doing. We would certainly want to make sure that we, as we say this, to make sure that one, people know this is not going back to business as usual. We still have restrictions, and we need to be cautious in how we socially interact with each other. We need to wear masks. And our vulnerable populations, there's no difference for them from red, high risk, to orange, moderate risk. They still have the challenge of being extra careful, extra cautious, because they are much more susceptible to this coronavirus, COVID-19, than the rest of the population. That's just the way it works right now. So again, good news, just some things that you'd be aware of. Most businesses we've never closed, by the way. Now we're saying opportunities to expand those operations. Particularly, we are encouraging people to wear masks. Again, I know it's not convenient. It's maybe not as stylish as we'd like to be, but wearing a mask is really important for not only ourselves, but for those that are working out there. When you go to a Smith's grocery store, all the employees there are wearing masks. And we as customers ought to be wearing masks too, to protect the employee and to make everybody feel safe. So it's an important aspect. In fact, hopefully the Lieutenant Governor will talk about what we've talked about as a new program called A Mask for Every Utahn. We're going to make this stylish and a thing to do and something we need to do if we're going to continue this trend. Dining in restaurant now is being made available. So before it's been curbside service, takeout, home delivery, those kinds of things, drive-through. But now we are opening up in-house dining at our restaurants, but there's going to have to be additional protocols to work on making sure that the tables are in such a way as to have social distancing occur between customers, hand sanitation as you come in, screening of not only the employees that come to work every day, but also the customers that come through the door, so that people know this is a safe environment to come and have your Wendy's hamburger or a sit-down nice meal at Valter's and everything in between. So again, eating out is going to be an opportunity now as we incrementally open that up as an opportunity. And that's going to be a great thing. Hair salons, those where you go to get your nails done, barbershops, those now are going to be opened up with, again, appropriate protocol in place to make sure that we screen people and protect the customer as well as the employee as they do these work on people with their hair and their nails. So again, it's really is an important day. It's a good day. It's a good milestone. I'll just conclude by saying this, Derek. One, this is really a regional approach. This is designed to make sure that we respect the differences that we have. We're not a one-size-fits-all philosophy here in Utah. This is not like Washington, D.C., which is just the opposite of that. This respects regional differences and cultures. We have 5 counties right now that have no infection, at least anybody identified having the COVID-19. We have some areas that maybe are not only ready to go to orange, but in a few weeks probably can go to yellow. And so if there's any variance out there, as I make this statewide order today, we would respectfully request the local government officials to work with their local health department, to work with our state health department. If, for example, there's a hot spot in Utah County that they need to deal with and address, they have the ability to say, well, we're ready to go to orange, except for this neighborhood over here, this location, which maybe needs a little extra attention for the next week or two before we in fact shift into orange. They have the ability to present their data, their statistics, and get a variance on that with working with our state health department. So again, we're respecting regional differences and local control. That's part of this order going forward today. So good news for all of us. This is the first step towards recovery. We've got to get stabilization in place, but I think we can do that. I like the trends. All of us need to continue to do what we've talked about, practicing social distancing, even though we have more opportunities to go outside, wearing a mask is appropriate, washing our hands, do the proper hygiene things. If we all do that, we all do our part, we're going to continue to go through this stabilization and then into recovery by summer, midsummer probably.
Governor, thank you for that explanation of moving from red to orange. I do have a couple questions that have come in for you, but before I do, I can't let the moment pass without emphasizing the two examples that you used of eating out, one being Wendy's and the other being Walter's. And I just happen to know you well enough to know that you do consider both fine dining.
Exactly. Absolutely. We get a Big Dave's Deluxe. I'm ready to go out there and have one inside the Wendy's restaurant, brick and mortar.
Governor, you, I think, appropriately mentioned that moving from red to orange does not mean that we become relaxed in our vigilance. In fact, if anything, it means that we need to even be more vigilant than ever in our hygiene, in our social distancing, and wearing those masks. You also mentioned that we're able to move from red to orange because we have been vigilant. But a question has come in that would it be possible if we don't do this the right way, and I say we collectively, the people of Utah, is it possible we might move back from orange to red? Is that a possibility?
It's absolutely a possibility. It would be the worst of all worlds, by the way. You don't want to move in a positive direction and have to retreat and come back. And that's why we're saying to our local government officials and our local health departments, you have a significant role to play to make sure you ascertain, are you capable of going into orange? Are there areas that have hot spots that need to be addressed? And if so, ask for a variance to keep this section of your town or your county maybe in the red area, so we don't go to orange and then have to roll back to red. And I expect that some of that will happen. But clearly, our plan envisions differences in regions where we could have the whole state as green and maybe a couple of spots are still back in orange. So that certainly is a possibility. We hope it doesn't happen, but we'll do what we need to do based on the data and the science and the medical advice as opposed to anything that's politically expedient.
I believe, Governor, that your announcement today included mentioning that there would be revised guidance that would be issued by you. Do you expect that revised guidance would address things like youth sports or potential on a limited basis of household to household visits? What do you expect on those fronts?
Well, household to household visits are easier. We're going to move the numbers up to 20. So household to household up to 20 would be very acceptable. We would still advise people to make sure that they're doing the appropriate hygiene preventive protocols, wearing masks, hand sanitizers, wiping down surfaces, knobs, rails, tables, etc. So household to household. But even more than that, you can actually have members that are not of your household come and you can have groups of 20. Again, we'd advise you to watch social distancing. And again, to have appropriate protocols in place for hygiene and hand washing and those kind of things. Wear a mask, and so that needs to continue, but you can have larger groups. we're encouraging people. Again, we have challenges with mental health, isolation. All of us should find somebody in our neighborhoods that maybe needs a contact with people. Maybe they haven't seen anybody for a long time. Maybe they're alone. And so we ought to knock on their door and with appropriate protocol and advance notice, probably say, hey, just want to come and check and see how you're doing, Derek. How's your mental health? How's your family? Maybe sometime just an encouraging word or a pat on the back with gloves on, would be what you need to have. But so those things are happening, opening up, and we all have an opportunity to make somebody's day better. And so we need to look for those opportunities and help people with their isolation. We have too much depression that's occurring out there with this isolation that we need to be keenly aware of. This is going to open up opportunities for us to help those people that are our neighbors and friends.
Thank you, Governor. And youth sports, will that be contemplated, or is that still to come?
Yes, well, thank you for reminding me about that. I'm actually going to, after I get off this call, I'll have another call that will be working with some of those involved with our schools, our school districts, our activities association. I've met with them once already with the idea of seeing if we can find a way, that's the phrase, find a way. There are probably ways to do it. Some ways may not be practical. Everybody comes with a hazmat suit and plays baseball. That might be a hard thing to do, but it is a way that you could do it. So we're saying, look and see what you can do. If there's ways, golf is maybe not as hard to imagine doing. You have a lot of social isolation on a golf course. And so there's some things that could be done easier than others, but let's see if there's ways to do them. We've talked with the Superintendent Sid Dixon and the Chairman of the Board, Mark Huntsman, to see if there's ways that we can have graduation, maybe virtual graduation, maybe video, still have people perform and give valedictorian speeches and those kind of things traditionally, but have them filmed and have that maybe as a DVD given to all the seniors as a memento. I know I wished I had one of those for my high school graduation. I don't have a picture. My parents, I guess, didn't have a camera or forgot. There was no protocol at the time as I walked across the stage to get my high school diploma. So in some ways, this could be even better for memory's sake. But they're trying to find ways. Some of it may be postponing it for a week or two longer. We've talked about, can you have some kind of activities, not just sports, but drama, musical activities, arts types of things that maybe could be done at the latter part of May or even the first part of June. And so those are being reviewed right now as we speak to see if there's a way, a possibility of doing things with some innovation. And I don't know what the answer to that's going to be, Derek, but we're probably going to know here in just a few days whether that's possible at all.
Thank you, Governor, and thank you for taking this time with us out of a very busy schedule. I want to highlight one other thing that you said and use that to transition now to our Lieutenant Governor. You talked about protocols for going to a salon, for going into a restaurant, and you used the term screening of employees. And we've asked the Lieutenant Governor to join us today to talk specifically on this town hall about testing and the importance of testing protocols. And we talk about assessments and we talk about screening and we talk about testing, but here to pull it all together for us, especially as we now move from red to orange, which will bring, I believe, these protocols, the screening, the assessments, the testing out of the realm of theory for many people and into the world of a very strong practicality. Thank you, Lieutenant Governor, for joining us.
Thanks, Derek. It's great to be with you. And Governor, thank you so much for the good news today. Derek, I want to thank the Utah Economic Response Task Force. I mean, you all have been the driving force behind the Utah Leads Together plan, the 2.0. There's been so much work that has gone into that with industry associations and employers throughout the state to give best practices. Again, people are calling us all the time and saying, and by people I mean other governors, and saying, hey, can you just give us those documents and can we just put our state's name on them? So the hard work has been well received and paid off. We are getting a lot of questions about testing and what that means, and do all of our employees need to be tested? And when we talk about assessment or screening our employees as they come in. What does that mean? Does that mean they actually have to have a test to see if they have the virus? And so Derek and I talked about this the last week about helping to clarify some of that. So when we talk about testing, when you hear us talk about testing, what we're referring to are two types of tests. One you will often hear is a PCR test. This is kind of the standard test. Right now, it's mostly a swab that is placed in the nasal cavity and swabbed for the virus. Then that swab is run through a battery of tests, a reagent that extracts the RNA from that test to see if you do have the viral DNA in that test. And so those are the tests. When you hear us giving every day the testing numbers, that's really what we're talking about. We have well over 40 different facilities throughout the state where people can get tested. The good news is that we are significantly increasing our testing capacity, and that is helping us understand how far widespread this disease is, what the rate of spread is. Now, anybody that has a symptom can get tested no matter how mild. We are now testing over, well, today was a little lower. The weekend tends to be a little lower, but last week towards the end of the week, and I'm sure we'll start again yesterday and today, over 5,000 people getting tested a day. Those are really good numbers and a five-fold increase over where we were before. So that's the first type of testing. That is right now available for anyone that has a symptom, although we are expanding that. Starting last week, we're going to be doing more testing of our healthcare workers. We're going to be more testing of our vulnerable populations. So where we're seeing the biggest outbreaks right now tend to be in our long-term care facilities. And so we will be going into those facilities with mobile labs and giving and testing all of the people in there, even if they don't have any symptoms, just to make sure we can find where this is spreading, especially with asymptomatic spread. The second kind of testing is antibody testing, and those are the blood tests that are starting to come online. ARUP at the University of Utah now has the ability to do antibody testing, and we will be rolling that out. Now, the purpose of antibody testing isn't to determine if you have the disease right now, because antibodies build up over time after you've had the disease. It's to determine if you've had the disease in the past. And you've seen some of those numbers coming out of New York. There's still some determinations being made over the accuracy of these antibody tests, but they are critical to help us understand how widespread the disease already is and help us make those decisions. Again, as we roll this out, we'll be going to frontline workers first, healthcare workers and others. We will also be doing some surveillance testing. About 12,000 people randomly selected throughout the state will both test to see if they have the disease now or if they've had the disease in the past, and that'll help us with our decision making. Now, when we talk about screening, and as the governor mentioned, going from red to orange, and part of moving into orange for a lot of employers is going to be screening of your employees. It's not the same as testing. We don't have, unfortunately, the testing capacity right now to test everyone in the state, nor would that necessarily, it actually would be great if we could do that right now. And then we would isolate everyone who tests positive. We would love to be able to do that. We just don't have the ability to do that right now. But for those who work in the restaurant business and others, and really everyone should be screening their employees. And there are ways to do that. Temperature checks are important. Now, we do know that this disease can spread asymptomatically. So we're not going to catch everyone, but we can catch people if they have symptoms and ask them to stay home so that they don't, and not just stay home, but go and get tested so they don't risk being impacted by infecting others there. So fever testing, and then just asking if they've had any symptoms. Again, the 6 symptoms that we're testing for right now and that are most important, the 3 most important are fever and tightness of breath, or breathing, or a dry cough. We've added 3 other symptoms: a sore throat, muscle aches and pains, and a loss of the sense of taste, the sense of taste or smell. So those are the 6 symptoms we're really watching out for, and those people should automatically go and get tested. We're also opening up testing now for anybody who has been in direct contact with someone who has been who was tested positive for COVID-19, and getting them tested. So we're rapidly evolving testing, but when we talk about screening, that's what we're talking about with our employees.
Lieutenant Governor, very well said. And you already mentioned that there is some confusion out there when we talk about assessment versus screening versus testing, and you explained that framework very well. I just want to highlight and give you a moment to also talk about this as well. A brand new app developed by the state of Utah, Healthy Together. This is an app for everyone, but specifically in this context, and we've got a lot of employers listening in today who are wondering, how will I do this for my employees? And I don't think it's too much to say that it all begins with the app. If you get the app, people can start doing that self-assessment. People who do that self-assessment, who then find that they do have one of the symptoms, can find out where they can go get that testing. It provides information on screening, et cetera, et cetera. Anything that you want to share specifically in regards to this new app?
Thank you, Derek. You know, it's a really big deal, and so many people have been helping to develop this app. It's in beta form right now, but everyone can download it and give us feedback and test it out. And we would encourage you to, and to have your employees do it as well. This is the Healthy Together app. You can find it in the Apple Store, or you can find it in Google Store as well. It's available on any smartphone platform. And what's so important about this app is exactly as Derek said, every day you can be prompted to take the assessment. It just very quickly ask you if you have any of these symptoms. If you do, it can refer you to get tested and show you where you can go to do that. Importantly, too, if you talk to the experts, the way to move from one phase to another and limit this kind of severe social distancing, the sledgehammer approach that we've had to do, is to get people tested, find out who has the disease, and then do contact tracing. And we're doing that as well as any other state out there. We have over 1,200 people engaged in contact tracing right now. And that is, you test positive, someone from your local Department of Health contacts you, and they start walking you through where you've been 7 days prior to having any symptoms. Who did you come in contact with? And then we reach out to them and get them tested as well. And so that's, again, a much more surgical approach to this. But the app, what it allows us to do, again, there are several important protocols around your information, your personally identified information. You own all of the data. You give permission on how that data can be used. You can have that data destroyed at any time. We destroy the data every 30 days. Only the health department has access to that data. All of these security measures are in place. It's very, very important. But what it allows you to do, and by the way, most of your apps are doing this right now. They're tracking where you go. You give them permission to do that. Google does it. A whole bunch of other apps do that. But here we specifically ask you, are you okay to allow your phone to track you? And again, that data does not come to us. It stays on the phone. But what happens is, if you test positive, then you give the state permission to share that with every phone that has come in contact with you who also has the app. So that is incredibly helpful for us as people, as citizens, to find out suddenly if someone has been in contact with us for 15 minutes, 5 days ago, and they tested positive. I can get a notification on my app that says, hey, you were next to a phone with somebody that tested positive. You need to go get tested and make sure that you don't have the virus. So this is a really important tool for those reasons that will help us take a much more surgical approach, joining together to defeat this virus.
Great. Thanks again, Lieutenant Governor. We're grateful to you and your leadership. Of course, Governor Herbert and his leadership. I do know that I see that you're working from your office at the Capitol today as opposed to your home office in San Pete. But either way, you've got the Gary Herbert Google or bobblehead looking over your shoulder, I noticed. So appropriately.
Very important. He's always watching over me.
Trying to keep him on his toes. You know, we're open for business here at the state. We're not like the federal government.
Thanks again to both of you. We highlighted today's town hall as about testing and taxes. And so we talked about testing. Now we want to move to taxes. Some important information with regards to the CARES Act and other federal relief that's been provided, often overlooked because of the immediacy of the PPP loans. But we've invited Miles Hansen, the president of the World Trade Center Utah, a member of the Economic Task Force who's been heading up specifically the federal working group, staying on top of all these federal programs, who's here again this afternoon to share with us some important tax-related information, and it will be important for your business. So go ahead, Miles.
Great. Thank you, Derek, and thank you to your leadership on the task force. Like you mentioned, over the past few weeks, we have had an almost singular focus on the PPP program and the EIDL loans, given the urgency that we all recognize would exist based off the demand for the program and the funding that was available. That's been added to, but that is going to deplete quickly. Utah companies have done a phenomenal job participating in the PPP program. We are well exceeding national averages and what forecasts were for what Utah companies would be eligible for here in the state. As we now shift our focus more broadly, these tax benefits that were part of the CARES Act are very important. They weren't as urgent before, but we want to make sure we're highlighting those for everybody who is tuning in today, because now is the time to start digging into these benefits that will help add both cash to your business now by amending previous year returns, as well as by saving money by deferring some tax payments and receiving credits for others. I'm not a tax expert. This stuff gets pretty complex, and so I'm going to start at the same place where I'm going to end, which is by letting everybody know to go to coronavirus.utah.gov/business. You can find information on everything I'm going to give a quick overview of there, as well as a link to receive assistance from our rapid response team. They are staffed with volunteers from 50 plus volunteers from 15 different organizations, including the Salt Lake Chamber, many other organizations, and they can go and provide some one-on-one assistance with this. And then really you want to talk with your tax advisor to go drill down the details on this. But very briefly, there are 6 main updates to our tax code and temporary benefits that were part of the CARES Act. The first was a delay in payment for your employer payroll taxes. This is the 6.2% that you pay towards Social Security on top of your payroll. You can defer that until 2021 and 2022. So that's an immediate way that you can keep some additional cash within your business by putting off these payments. This is a deferral. It's something that you can avoid paying, but you can put it off and pay 50% in 2021 and 50% in 2022. The second benefit is an employee retention tax credit. And a significant caveat here, any company that received a PPP loan is not eligible for this tax credit. But for everybody else, this is something that you are eligible for. This allows you to receive a tax credit for 50% of your payroll taxes paid up to $10,000 per an employee. So the way it works is you look at your wages you paid from March 13th until the end of this year, 50% of what your payroll taxes with that $10,000 limit per employee, you then can get a credit that you can use and reinvest that back into your business. And this is interesting when you couple it with the deferment of payroll taxes. What this means is you can avoid paying the tax until 21 and 2022. But if you didn't receive a PPP loan, you can go get a credit in advance of what you will pay for payroll up to 50% of what you're paying. So again, that's cash back to your business that you can use to move forward. The third item I wanted to highlight, and the next 3 are all related and retroactive back to prior years. And so you can go back and amend your 2018 and your 2019 taxes, as well as take advantage of these changes in 2020 by amending your prior year returns as these apply to you. You can get an amended refund, an additional refund from prior years back into your business. So this is a way to get some additional cash back into your business. The first of these 3 are a modification of net operating loss limitations. Many businesses will remember that in the tax reform bill that was passed in 2017, there were more stringent limitations put into place on how businesses could carry forward net operating losses from previous years. The CARES Act eased these limitations, and so now you're able to carry losses back up to a 5-year window in previous years. So in 2018, that's back to 2013, 2019, back to 2014. So again, if you filed your taxes in 2018, if you've already done it for 2019, before the CARES Act, you had these additional limitations. Now, if this applies to you, you can go back and get some additional cash back in your business. The other change is how you can write off expenses for qualified improvements. if you've made a qualified improvement, which typically means an improvement on the inside of any of your facilities, since January 1st, 2018, you can go back and write off as depreciation the total cost of that improvement. So the example that I was given when I didn't quite understand this is if you owned a chain of, say, Arby's restaurants, you go back and say you renovated them in January 2018 and you spent $3 million. When you filed your 2018 taxes, you probably only wrote off about $75,000 of those improvements as depreciation. Now you can go back and amend your 2018 return to write off the entire $3 million investment that you made into your properties. And again, that'll be additional cash back that will come as the IRS processes your amended return. The third item I'll highlight here very quickly is that there are temporary increases in interest rate deductions. So if you're paying mortgage interest or other types of interest, again, with tax reform in 2017, there were more stringent limitations put into place. The CARES Act eases those, so you can go back, amend your prior year returns, and get some additional cash back. The last item that I'll highlight is a tax credit for paid leave that you have provided as part of the Families First Coronavirus Response Act. So if people remember, in the middle of March, Congress passed a law that made it a requirement for businesses to provide paid leave for employees that were impacted by COVID-19, whether they got sick, whether a family member got sick and they had to take care of them, whether or not that they were providing, supporting kids who weren't in school. So employers have had to be paid leave to their employees. What the CARES Act did is it made it so that you could get a tax credit that again is applied to your payroll taxes based off of the amount of paid leave you provided to your employees. The effective date on that was April 1st, which is a little unfortunate because many companies were providing this leave through the second half of March. But from April 1st on, any paid leave that you are providing, work with your HR people, work with your tax people, because you should be able to get a tax credit for the value of that leave that you provided. And again, just to end where I started, this is a lot of information. It's dense. Go to coronavirus.utah.gov/business. You'll find more information there, as well as a link to get assistance from our rapid response team. Derek, back over to you.
Thank you, Miles. Great overview, important information. Just as you said, so important to understand the details. Speaking of the details, Miles, you've been talking about on the PPP side of things and the business side of things. Now we want to go as our concluding presenter to John Pierpont, who's the Executive Director of the Utah Department of Workforce Services, to talk about on the unemployment side. A lot of details, especially right now where we've got businesses who are thinking of their own plans to reopen, what that means to bring back workers, some that have been furloughed, possibly even hiring those who are currently unemployed. Working through all those details is important, and here to help us understand it is Executive Director John Pierpont. Thanks for joining us, John.
Thank you, Derek. Thanks for inviting me to participate again this week. Appreciate the time. I'm going to set this up for a couple of people that are boots on the ground, but Senator Lee mentioned in his remarks about the CARES Act and the additional $600 that the UI claimants are receiving on top of their typical UI benefit. And that's causing some, not confusion, but I would say questions about how employers now navigate the PPP loan, their obligation to pay their employers or their employees, and how that relates to the unemployment insurance program. That's probably the number one question that we're getting right now as the department is how do we best navigate this so that businesses know how to handle the employees as well as the employees that have been impacted either by furlough or layoff, make the right decisions that don't penalize them here in the short run. So I've asked Marla Trollan, who's the director of the Utah District Office of U.S. Small Business Administration, and then our own Kevin Burt, who's been on here before, and he's our Unemployment Insurance Division Director. Marla's going to start by talking about how the loans work and how best employers can navigate that with the employees. And then Kevin will address how the impact of the unemployment insurance for the employees that are being reintroduced to the workforce. So I'll turn it to them. I know we're short on time, but hopefully we can get through it. So Marla, if you'll start, and then Kevin, yep, go ahead.
Sure, thank you. And thank you for the opportunity to be on the webinar this afternoon. John's pulling it up, PowerPoint on the screen here. So I'm going to quickly walk through the PPP, but before I do that, I just want to run through some of the CARES Act numbers. John, you want to go to the next? Thank you. So the amendment included $310 billion additional for the PPP program, including $30 billion set aside for financial institutions with less than $10 billion in assets, and $30 billion for those financial institutions that have between 50 or 10 to 50 billion in assets. There was also $50 billion for EIDL, which is our economic injury disaster loan program, as well as the emergency grant, $10 billion for that. And as of today, this afternoon, these are the current round 2 numbers for the PPP program. This is national. We don't have our state numbers yet, but we're at $52 billion as of this afternoon, 475,000 applications and approved loans. The lenders, you can see there that the $30 billion for those lenders with $10 billion or less in assets has already been reached. Again, we reached that earlier this afternoon with 331,000 loans. The lenders between 10 and 50 billion were at about 10 billion plus. I'm sure that number's gone up over the last few hours, with about 84,000 approved loans. So we are going through the money very, very quickly, which we kind of anticipated. So hopefully folks are getting their funding rather quickly. The funding is administered under the PPP by our SBA lenders across the state. We typically work with about 70 lenders, but now we're up over 200 lenders statewide. It does include 100% guarantee by the SBA. And the proceeds for the loan can be used, and I know most of you already know this, but it's primarily for payroll costs, including salary and wages. And those wages is 100,000 or less. Now that doesn't mean you can't pay for employees making over 100,000, but that's what we cap it at. It also includes vacation, sick leave, severance, healthcare benefits, retirement benefits. And there are special rules set aside for self-employed individuals, as well as LLCs and partnerships, et cetera. The loan can also be used for mortgage interest payments, rent, utilities, and interest on pre-existing debt. Let's get into the next slide. And the eligible entities, of course, the small businesses, that we have included agricultural businesses. So we've already done some webinars for them specifically. It does include tribal businesses, as well as nonprofits, 501c3s, and veteran organizations. Sole proprietors, independent contractors, and self-employed individuals are also eligible. You do have to be in operation on or before February 15th in order to be eligible for this loan. The size standards are typical for SBA, which is 500 employees or less. We do take into account the NAICS code that a business is operating under. And we also look at, under the NAICS code, the net worth and that type of thing. We do have some affiliation rules that have been waived under this program, including businesses with multiple locations, and also franchises listed in the SBA's directory. Ineligible entities are those that have been engaged in lending, so financial institutions, as well as developers, landlords, life insurance companies, pyramids, private clubs, etc. And of course, any businesses that are engaged in illegal activity, or businesses with 20% or more owners that have legal issues of that type. Also, we are not accepting applications from owners that have been defaulted on federal loans or prior loss to the federal government. The loan terms for this program goes up to $10 million per business. and it's based on a formula, not projection. So again, most of you probably already know this, but we're taking that 2.5 times the applicant's monthly payroll costs over a 12-month period of time. And if a business has been in operation less than a year, then we're going to use January and February of this year. The maturity on this is quite short. It's only 2 years, but a very low interest rate of 1%. And the payments are deferred for the first 6 months. Again, some additional waivers under this program, including we're waiving the guarantee fee and the annual lender fee, as well as our credit elsewhere requirement that we typically would have under a 7A. We're waiving the collateral and personal guarantee requirements and the prepayment penalties. Now, this is probably the most important aspect of the PPP, which is the forgiveness. And we get all kinds of questions about this, so we're prepared to answer any that folks might have. But basically, we're looking at the 8-week period of initial loan disbursement. The borrower then can request forgiveness on the payroll costs, mortgage interest rate, rent, utilities, etc. Those payroll costs must account for 75% of the requested amount of forgiveness. And the borrower has to supply specific documentation in order to for us to consider the forgiveness, including their payroll, their tax filings, state filings, their verification of their utility payments and their mortgage, rent, and a certificate from a representative. So again, those are the kinds of things that we're going to take into account. Under that 75% payroll costs, and I know John had mentioned this earlier, businesses that reduce the number of employees during the 8-week period, that will be accounted for in the forgiveness portion. So the forgiveness will be reduced by that amount. Employers that restore their employment numbers and salaries by June 30th, and that's the cutoff date, will not experience any reduction in forgiveness. But employers can require employees to return back to the payroll rather than stay unemployed and collect unemployment insurance. And that kind of gets at what John was saying earlier. This is an important aspect of this program. The purpose is to try to get folks working and off unemployment. And so when we're taking that into consideration for forgiveness, we will be looking at that. And I think that's it. We do have some contact information here, and we can share this via the chat if anyone has any questions. I do want to do a shout out though for our rapid response team that we were able to establish, and thanks to Miles and his team at the World Trade Center for setting this up. Currently, I think they're nearing 1,800 inquiries that they've helped us with. So just a huge shout out to the team and all those volunteers that have helped us out so much. Thank you.
And then I'll just tack on a few things. This is Kevin Burt with the Unemployment Insurance Division. And so one of the questions was asked is if I, as an employer, offer a job to an employee and they turn down that job, how does it affect the unemployment insurance benefit? And the answer is it does affect the unemployment insurance benefit. So it's important as an employer that you communicate directly to your employee that you are offering that job, that you explain to them the work that's being offered, the start date, what the wages are, the types of work, and the location and the condition. Essentially what you're doing is you're offering the same job, and if that person chooses to not take that job, then we have an online submission form that you as an employer can submit and report that a person refused the job. What that does is it'll freeze the unemployment benefit, and we will look at it and see if it is a quit. We're looking at the suitability of work. So if you are offering the exact same job and the person is turning down that job, in most instances, it will be considered a quit and the unemployment benefits will end. So there's been discussion about that unemployment will prevent people from accepting the job, but that's not the case if the employer is reporting people who are refusing to come back to work. And the last thing that I'll say about unemployment insurance, not everyone will have the PPP loan, and it might be more of a dialed up, increased employment to people. So maybe they've been furloughed, and as we start to increase the economic activity, maybe I as an employer can't bring someone back full time. I can only bring them back about 15 hours a week. That actually works very well with unemployment. Unemployment insurance is a week-to-week program. So if a person applies week to week and attests to how much they earned every week. So if this week they are furloughed, they would report 0 hours. They would get the full state benefit and the $600 stimulus. If they return to work next week and work 15 hours a week, they would report the hours or the income earned. And then the state benefit would be prorated. As long as they're eligible for a state benefit, it'd be reduced because of those wages. They'll still get the $600. So this allows an employer to gradually increase their workforce as the economic activity returns. And it also does allow that $600 stimulus to continue to flow through the economy, increasing some spending capacity to try and aid that economic recovery. But in short, if an employee refuses work, suitable work, and the employer reports it to us, and the best way to do so is electronically, in many instances, the unemployment will end for that employee due to a quit. And also unemployment will work as we gradually turn up the dial on this economy and get that economic activity to return.
Great information. Thank you, Kevin. Thanks, Marla. Thank you also, John. Thanks to everyone who joined our town hall. 2 very quick reminders. First, just a reminder that as the governor mentioned, he'll have a new directive with new details coming out for going into effect on Friday. We will cover those at our next town hall, which will be a week from today. Also to let you know, we will not have a town hall on Thursday. We've gone to a once a week Tuesday town hall, but I do want to let you know about a special Utah Leads Together webinar where we're looking at specific and detailed information, including the next webinar, which will be tomorrow at 2 p.m., implementing a safe and healthy work environment plan for your business. You can find out more information about that Utah Leads Together webinar series at the Salt Lake Chamber's website. We'll see you all then. Bye.